morning again, everybody. This morning we're going to start our show talking about a serious neurological disorder that interferes with the brain and the spinal cord. It's called Chiari malformation, and we are so happy to have a local neurological specialist, Dr. Lee Gutterman, who is here with us this morning. And Doctor, you are with Blue Cross Blue Shield, do I understand?
I do take Blue Cross Blue Shield, but I'm a neurosurgeon with the Catholic Health System.
Catholic Health. So we're going to be talking about Chiari malformation and syringomyelia.
Syringomyelia. Yeah.
Okay.
It's $1 million word for water on the spine, but we're going to go through all that.
And how many people suffer with this here?
So it looks like it's about one person in every 1,000 live births ends up with this type of malformation. But now that there's so much imaging going on, we're picking up even more of it that has no symptoms associated with it. So we seem to be diagnosing more and more cases with each passing year.
All right, we can get going with our pictures? Absolutely.
So here is a picture of the brain where we've made a slice right down the middle and we're looking in. And you can see brain, and you can see the back of the brain called the cerebellum, the brainstem, the spinal cord. And Chiari malformation or abnormality is when the bony coverings of the brain, the skull, are too small to accommodate the contents of the brain. And so what happens is the brain starts to go down through the hole in the base of the skull because it doesn't have enough room in its little area, and that causes pinching of the spinal cord and the brainstem, excuse me. And so the other thing that can happen is there are fluid-filled spaces in the center of the brain. And if you pinch down here, what you might do is make these fluid-filled spaces increase in size, which would put pressure on the brain. And you notice that the fluid goes all the way down into the spinal cord, and if you pinch it over here, you may get that canal, which is very thin, to blow up like a balloon, and that's the syringomyelia, or water on the spinal cord problem. So this is an actual picture of a brain that's made by cutting this way and looking in, and it's this region that gets pinched. This is that cerebellum in the back of the brain, and this is the brain stem and the spinal cord down this way, and these are the fluid-filled spaces, and that's the normal size. But if you pinch, they can get very large, and they can also make a cavity form down in the spine. So scientists believe that it was about 1 in every 1,000 births, but we do so many MRIs now for so many different reasons that we're picking up that pinching much more often than we were in the past. And so let's see what that pinching really does to someone. I would say that the Chiari syringomyelia patients are some of the bravest patients I have ever dealt with, because they have pain every day of their life, and yet they go on. They continue to work, they continue to deal with it. They get generalized discomfort, they get numbness, tingling, their extremities can burn, they can have headaches every day.
I hear that, especially if you sneeze or you cough, that can bring on a severe headache.
You are exactly right, Linda, and that's because when you cough or sneeze, the pressure in your head goes up, and it makes the brain push down through the hole and squeeze the spinal cord even more. So what is the malformation? The malformation is that the bones in the skull base fuse in utero too early, and as a result, the brain, when it grows, doesn't have enough room. And so the only way it can make more room is to go down through the hole in the base of your skull, and that results in the pinching. And it pinches that brainstem, cerebellum, and spinal cord that are so important, and it can result in water on the brain, and it can result in water on the spinal cord. So this is a picture of the actual malformation. You can see the cerebellum. You can see a piece of the cerebellum that's going through the hole called the foramen magnum in the base of the skull. And you can actually see the pinching, so where the arrow is.
So it doesn't make the skull itself deform, because the skull is already formed, hard?
You're right on the money. It does actually change the shape of the back of the skull.
Wow.
So your skull, if it was normal, would have a nice curve to it, and maybe if you had Chiari, the skull in the back would be flatter, and that cavity called the posterior fossa, or the room where the cerebellum and the spinal cord live, is smaller. And so the early fusion of the bone in utero appears to make this part of the skull smaller.
So when do we start to diagnose this? How old are people?
So you can diagnose some of these abnormalities in utero using ultrasound.
Oh, you can?
You can, but there are some new techniques, very new, to operate in utero, but that has not caught on yet. Otherwise, when the babies are born, that's when you start to recognize these problems.
Really, as soon as birth?
Oh, you can see some of these problems at birth, because if you've pinched off the spinal cord and the fluid in the brain is retained as opposed to draining, the head size will be larger, the fontanelle may bulge, but so now we have the other piece of the disease, which is the water in the spinal cord, okay?
Okay.
And so now we're going to look at a picture. This is a spinal cord, and I think you can see, sorry.
Come on back, spinal cord.
I think you can see that there's a big cavity or a cyst, and those cysts form because of the pinching at the skull base.
Oh.
So now we're going to talk about a patient that I had in common with another neurosurgeon. She was 34. She came in with severe neck pain and headache. She had intermittent confusion. She had numbness and tingling in her arms.
That's scary symptoms.
Especially when she sneezed or coughed or bared down in any way. And she was getting progressively worse. So here's her MRI, and let's look at it carefully.
Gosh.
Here's the pinching.
Okay.
Here's the piece of the brain coming down through the base of the skull, and as a result of that pinching, she formed a cyst in her spinal cord. So here's the chin, here's the eye, this is the neck, and there's a cyst in the spinal cord due to that pinching.
Oh.
And so, I just wanted to emphasize, we're going to talk about this piece first, which is the Chiari. And you can see it in close-up, the pinching, and then we took her for surgery, and this is the back of the skull, and we drilled out all this bone to get rid of the constriction, and then post-operatively you can see that she's not pinching anymore because the bone, which used to be over here, was drilled off, and the syrinx, that it got better over 2 or 3 months on its own without operating on it directly. We used to have to put tubes into the syrinx in the spine to drain it, and now we realize that when we decompress it, the syrinx goes away on its own.
Oh. So what do you put in place of the skull?
You can put a titanium plate to cover up that area, but you don't have to, because the muscles are so thick in the back of the neck that they cover up the defect that you've created.
Well, isn't that interesting?
It's very
I would have
interesting.
never guessed that.
So now let's talk about research.
Okay.
Surgery only does so much. It can make you a little bit better, maybe it'll make you a lot better, but it doesn't cure you, and it never takes away all the symptoms. So there are two foundations, Conquer Chiari and the Column of Hope. Both have, one is local and the other one is national with a local chapter, and we fund research. We raise money in these two foundations every year, and that money goes directly to research, not to paying people or anything.
Yeah.
And so this was a project that was jointly sponsored, and the researcher in Warwick, England, who we fund, said that the problem is in this bone right here. He figured that out. And so we're going to zoom up on that bone, and now listen to this. This is fascinating. He took cells of his own in his model, and he labeled them. And they're specifically cells that come from the developing fetus, so that's what we're trying to tag, at the time when the spinal cord is being formed, very early, first trimester. And he labeled the cells. And this is the same piece of bone that we just looked at, and he found, listen to this, that cells from the developing embryo are not communicating properly, and that's why you get the early fusion of the bone. All
Amazing.
funded, and I want to say this, this work was funded first by Conquer Chiari, and then Column of Hope picked up phase 2, and thanks to the people in Buffalo, New York,
Yay.
this lab in Warwick, England is funded to try and figure out why patients develop Chiari, thanks to Buffalo.
Thanks to Buffalo. And we're going to talk to some people from Buffalo who are involved in this. We're going to take a quick break and come right back. It's fascinating, and it's so nice to know we here in Buffalo are working on that cure personally.
It's fantastic.
All right, everybody, stay right there. We'll be right back.